Avoidant personality disorder represents one of the most common yet underrecognized personality disorders, affecting approximately 1 to 2% of the general population with relatively equal distribution between males and females. This complex mental health condition is characterized by a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation that begins by early adulthood and presents across various contexts. Unlike simple shyness or introversion, avoidant personality disorder involves profound and persistent patterns of avoidance that significantly impair social, occupational, and personal functioning, creating a prison of isolation that individuals desperately want to escape but feel powerless to overcome. The diagnostic criteria for avoidant personality disorder require the presence of at least 4 specific symptoms that create significant distress and impairment in functioning. These symptoms include avoiding occupational activities that involve significant interpersonal contact because of fears of criticism, disapproval, or rejection, being unwilling to get involved with people unless certain of being liked, showing restraint within intimate relationships because of fear of being shamed or ridiculed, being preoccupied with being criticized or rejected in social situations, being inhibited in new interpersonal situations because of feelings of inadequacy, viewing oneself as socially inept, personally unappealing, or inferior to others, and being unusually reluctant to take personal risks or engage in new activities because they may prove embarrassing. These criteria paint a picture of individuals who live in constant fear of judgment and rejection, leading them to avoid the very social connections they deeply crave. The development of avoidant personality disorder appears to stem from a complex interplay of genetic vulnerabilities, temperamental factors, and environmental influences that often begin in early childhood. Research suggests that children who later develop avoidant personality disorder may have been born with temperamental sensitivity or behavioral inhibition, making them more reactive to social stimuli and more likely to withdraw from novel or challenging situations. When these innate vulnerabilities are combined with critical, rejecting, or emotionally distant parenting, the stage is set for the development of avoidant patterns that persist into adulthood. Childhood experiences of bullying, ridicule, or social rejection can be particularly damaging for temperamentally sensitive children, creating lasting wounds that shape their fundamental beliefs about themselves and their place in the social world. Parents who are overly critical, perfectionistic, or emotionally unavailable may inadvertently teach their children that they are fundamentally flawed or unworthy of love and acceptance. Some research suggests that parents with their own social anxiety or avoidant tendencies may model fearful approaches to social situations, transmitting these patterns to their children through both genetic and environmental pathways. Living with avoidant personality disorder creates profound challenges that affect virtually every aspect of an individual's life. The intense fear of criticism and rejection leads to patterns of social isolation that can become increasingly entrenched over time. While individuals with this disorder desperately want close relationships and social connections, their overwhelming anxiety about being judged or rejected prevents them from taking the risks necessary to form meaningful bonds with others. This creates a painful paradox where the very thing they most desire becomes the source of their greatest fear. In romantic relationships, individuals with avoidant personality disorder face particularly complex challenges. Their deep longing for intimacy conflicts with their terror of being truly known and potentially rejected by a romantic partner. They may engage in relationships cautiously, always holding back parts of themselves to avoid vulnerability. The fear of being abandoned or criticized can lead to hypervigilance about their partner's reactions, interpreting neutral or even positive responses as signs of disapproval or rejection. This constant anxiety can create self-fulfilling prophecies where their fearful behavior actually drives partners away, confirming their worst fears about their own inadequacy. Professional settings present unique challenges for individuals with avoidant personality disorder, as their fear of criticism and judgment can significantly impact their career development and job performance. They may avoid pursuing promotions or challenging assignments that would require them to be more visible or interact with new people. Their tendency to interpret feedback as criticism can make them appear defensive or unable to accept constructive guidance, potentially limiting their professional growth. The avoidance of occupational activities involving interpersonal contact can severely restrict career choices, leading individuals to settle for positions that are below their capabilities simply because they feel safer in isolated roles. The internal experience of individuals with avoidant personality disorder is characterized by chronic feelings of inadequacy, shame, and loneliness. They often engage in harsh self-criticism and maintain unrealistically high standards for themselves while simultaneously believing they are fundamentally flawed or inferior to others. This creates a cognitive trap where they feel they must be perfect to be acceptable, yet believe they are incapable of achieving such perfection. The constant vigilance for signs of rejection or criticism is emotionally exhausting and can lead to chronic anxiety, depression, and physical symptoms of stress. Social situations that most people navigate with relative ease become sources of intense anxiety and distress for individuals with avoidant personality disorder. They may spend hours analyzing social interactions, searching for evidence that others were judging them negatively or preparing elaborate scripts for future encounters to avoid potential embarrassment. The fear of saying or doing something wrong can be so overwhelming that they may avoid social gatherings entirely, leading to increasing isolation and reinforcement of their avoidant patterns. Diagnosing avoidant personality disorder requires careful assessment by qualified mental health professionals, as the symptoms can overlap significantly with social anxiety disorder, schizoid personality disorder, and other conditions involving social withdrawal. The diagnostic process involves comprehensive clinical interviews, psychological assessments, and careful observation of behavioral patterns across different settings and relationships. Clinicians must differentiate between the fear-based avoidance characteristic of avoidant personality disorder and the lack of interest in relationships seen in schizoid personality disorder, or the episodic nature of social anxiety that may not permeate all aspects of functioning. Treatment of avoidant personality disorder typically involves psychotherapy approaches that focus on gradually building confidence, developing social skills, and challenging the negative beliefs that maintain avoidant patterns. Cognitive behavioral therapy is particularly effective in helping individuals identify and modify the distorted thoughts and beliefs that fuel their fears of rejection and criticism. Exposure therapy techniques can help individuals gradually face feared social situations in a controlled and supportive manner, building confidence through successful experiences. Group therapy can be especially beneficial for individuals with avoidant personality disorder, as it provides a safe environment to practice social skills and receive feedback from others who may share similar struggles. The group setting allows individuals to challenge their assumptions about how others perceive them and to develop more realistic expectations about social interactions. However, group therapy must be carefully structured and supported to prevent individuals from becoming overwhelmed by the social demands of the group setting. Psychodynamic therapy may help individuals explore the childhood experiences and family dynamics that contributed to the development of their avoidant patterns. Understanding the origins of their fears and developing compassion for their younger selves can be important steps in the healing process. Family therapy may also be beneficial when family dynamics continue to reinforce avoidant behaviors or when family members need education about how to provide support without enabling avoidance. The therapeutic relationship itself is crucial in treating avoidant personality disorder, as it may be one of the first relationships where individuals feel safe to be vulnerable and authentic. Therapists must be particularly sensitive to signs of shame or fear of judgment, creating an atmosphere of unconditional acceptance while gently challenging avoidant behaviors. Building trust and rapport may take considerable time, as individuals with avoidant personality disorder may initially be suspicious of the therapist's positive regard or fearful of being judged even in the therapeutic setting. The prognosis for avoidant personality disorder can be quite positive with appropriate treatment and support. Many individuals experience significant improvements in their social functioning, self-esteem, and quality of life through dedicated therapeutic work. However, change typically occurs gradually, and individuals may need ongoing support to maintain their progress and continue developing their social confidence. The key to successful treatment often lies in helping individuals develop a more balanced and realistic view of themselves and others while building the social skills and confidence necessary to form meaningful relationships despite their underlying vulnerabilities.